Newsradio 700 WLW.
All right, let's go to Dr. Katie Jarvis now, healthcare efficiency expert. Doctor, thanks for being on the show.
Thank you for having me.
All right, so we got cases of COVID rising right after the protesters, right after the holidays. I mean, it makes perfect sense, right? You have thousands of people in the street. You have people getting together with family. Kind of obvious things are going to go up.
And they did.
So why should we be concerned about it?
Well, I think that we've seen several hospitals in Florida who have filled up their ICU. So 2 hospitals in Palm Beach and 1 hospital in Miami were reporting entirely full ICUs, according to the Florida Hospital Association. So that's just, or Florida Healthcare Association. So that's just an incredible number of people in the ICU. Same thing here in Texas. Mm-hmm. We have ICUs filling up in Houston and San Antonio and Dallas at record numbers as well.
All right, so make me understand. You have people now saying that we opened up too early, we should do this, we should do that. We shut down for an extended period of time, shut down everything. We've had people in masks, we've had gloves, we've had social distancing. Yet it seems like we're still back to square one, if not past square one. So that tells me that shutting down and everything we did really didn't work. And we're going to have to let this virus run its course. And let's not forget that the death rate has been declining every week. That's something that does not get reported in the news. So again, make me understand why we need to shut down, because I don't get it.
Sure, because it's incredibly, I totally understand it's incredibly painful to shut down. It's hard on our economy, and it's hard on us as individuals to shut down as well. So I get it. I think that, in Texas, our governor said, up until May, we were doing great because the efforts to shut down and social distance really helped us not spread the disease. And then Memorial Day hit and protests hit, and people just kind of relaxed a little bit and didn't wear their masks. And all of a sudden, we see these record number increases. I think if we're really, really careful and we wear our masks and we social distance, we can slow down the spread of this disease so that we don't have to shut down all of our economy again or for a really, really long time.
Okay, and I understand that. But we did that. And then as soon as we come back, it resurfaces. So should we not go with the herd mentality? Should we not just say, look, we got to learn to live with this thing, or we got to let it run its course or burn out? Because, I know there's talk about vaccines, but, Doctor, we don't have vaccines for half of the viruses or the diseases we've seen in the last 20 or 30 years. What would make us think we're going to have one now?
Well, actually, I was a really big skeptic about vaccines early on. I'm not anymore because of the record pace that they're getting through the FDA clearance. So in the past, the coronavirus, the regular common cold, mutates so quickly that we weren't able to get vaccines out into the market fast enough for the common cold. Now, the FDA has really expedited the process of getting the vaccines through. And so I think that we have vaccines that are in phase 3 or slated to go into phase 3 within this month. And that's the final phase before they hit the market. So, for example, Moderna's vaccine, they're projecting that they'll go into phase 3 in July or August. If they go into phase 3 this week or next week, then we could be talking about them having the clearance to sell their vaccine in a month and a half or 2.
Talking to Dr. Katie Jarvis right now, healthcare efficiency expert. So let's go to that question. If we do have a vaccine, do you think it should be mandated? Because I have a lot of people who have said there is no way in hell they're going to get a coronavirus vaccine. And when you take a look at the flu, Doctor, less than half the adult U.S. population received a flu vaccination last year. So people, do you think it should be mandated?
It's a really interesting question. So the flu vaccine is something that 48% of people got who were adults in America last year. Mm-hmm. So clearly that was a well-accepted vaccine that's been out on the market for a long time. We have minor changes in the formula every year, but it's a well-known thing. And so if we only had less than half of people get that, it would be naive to say that we think that we're going to get 70 to 80% of people to take a vaccine against coronavirus. Right. So then the question becomes, does that give us enough herd immunity? And, I've thought a whole lot about this month because it's close to the 4th of July. And it turns out that George Washington was the first military leader to ever vaccinate an entire military. And so he had this question about, should I give a novel vaccine, the first vaccine for smallpox, to a military when it's unknown and it's risky? What he didn't do was give it to the entire American public. So he didn't strip the American public of their freedom. He just gave it to the military. Now, we won the war because our troops were well enough. But the question then becomes, what do we do about a vaccine? I think it would be hard to strip Americans of their right to refuse medical care. I do know that there are travel restrictions for certain vaccines. Like you can't go to certain countries that have yellow fever if you don't have a yellow fever vaccine. So I imagine governors might have the ability to regulate that. Can somebody fly into, say, New York State if they haven't had a coronavirus vaccine? They can certainly quarantine people, so I think it looks like they might have that power.
Right.
Should publicly traded companies report the percentage of their employees who have had the vaccine so that shareholders know the risk of, increased wage expenses to be out of work because they get sick from coronavirus? That's something the FCC should answer.
Let me ask you this. As you know, for every action, there's a reaction, okay? Yeah. What do you think the numbers are going to be when all this is said and done on childhood obesity, adult obesity, suicides, abuse in the household, mental, physical destruction from how we've reacted to COVID? And this is where I get back to, and 40 million plus on unemployment, 40% of small businesses not coming back. This is my angle that seems like nobody wants to talk about, nobody wants to listen to. It's, oh my God, the numbers are up, we got to hide. And I think it's ridiculous because I think what we're doing in how we're handling COVID, the repercussions are far worse than COVID itself.
Well, it is so hard because it is a balancing act, right? I mean, obesity is already very common in the United States, and it will become more common with this. And that leads to so many of the medical problems that I see. So I understand what you're saying. I think that governors have really difficult decisions on keeping society open versus shutting it down because of that balance. One thing I think we could do is we have a lot of Americans who are on unemployment. You just mentioned that. And, overwhelming numbers of unemployment right now. And then I'm seeing reports that, like, the Florida governor said that he had roughly 10% of the needed contact tracers for, tracking down this disease and making sure that it doesn't spread. And I know that contact tracing will help decrease the spread of this disease. So, why not use everybody who's receiving federal unemployment to take a contact tracing course? There's a really cheap one on Coursera. And then have them help with the effort of contact tracing so that they can get back to work faster, so that we can keep society humming and get back to our normal lives. Yeah,
I guess that could help. I don't know if it's going to help when you've got 40 million plus. I don't know how many tracers you need, but, it's just back to the fact that if you take nursing home deaths out of the equation, our death rate in the United States drops dramatically. I think it's like 40 to 50% of our deaths are nursing home related deaths. So why aren't we putting all of our resources in protecting those people and letting everybody else go back to living their lives? Because 85 to 90% of us are going to experience nothing or a mild cold because of COVID.
Yeah, but that's the problem. If you don't experience any symptoms, or experience mild symptoms, then it makes it easier to go back to work and feel like, well, I can go back because I feel fine. But you're still shedding and spreading that virus. So honestly, if for the people who have had it or have it, if they would just social distance and just isolate for the time frame that's recommended, then I think we can, really, really slow down this virus. And that's what I think will really get us out of this trouble.
All right, Doctor.
Otherwise, it'll just spread like crazy until it wears itself out.
But that's my point. You just made my point. Isn't that what we should do? Because this thing isn't going to go away. A virus it's either got to burn itself out or it's just going to, it's not like if we hide from it, it's going to all of a sudden go, nobody's here, I'm going to leave. It doesn't work that way. You know that. Well,
but if we could get a vaccine out into the market, then we could really save lives with that. So that's the real toss-up is, can we get that vaccine fast enough? And will the virus have mutated before that happens?
All right, Doctor. Thanks for your time.
Thank you.
Dr. Katie Jarvis, healthcare efficiency expert.